coding changes are coming, what info was shared about new rules and regulations at this year's AAO Annual Meeting?
I'm Greg Notstein, that's Scott Chriswanis, and this is New Retina Radio from Retina Today and Bryn Mawr Communications. Joy Woodke, who is a coding and practice management executive at the AAO, outlines which coding changes clinicians can expect to see in 2021.
Which codes are eliminated? What's staying the same? Keep it here to find out.
In 2021, E and M codes, or Evaluation and Management Codes, will undergo their most significant changes since 1997. To hear the details about those changes, we are joined by Joy Woodke.
Ms. Woodke is the Coding and Practice Management Executive at the American Academy of Ophthalmology in San Francisco. Ms. Woodke, thank you for providing this update on New Retina Radio.
Thank you for inviting me. It's great to be here.
Knowing about the coming changes to coding are important for anyone who wants to avoid an audit or any unpleasant surprise. What are some of the biggest changes coming in 2021?
Well, first, the elimination of CPT code 99201. But the most significant change is that a medically appropriate history and examination will be needed in lieu of the previously required history and exam elements, and that the level of E&M code will be determined based on the documentation of medical decision-making or total physician time.
Let's start with the elimination of 99201. What do our listeners need to be aware of?
Well, 99201 is the new patient level 1 code, and the clinical vignette would be an initial office visit for a 10-year-old girl for determination of visual acuity as part of a summer camp physical. This code actually has very low utilization in ophthalmology, around 1%.
So you also mentioned that there is a medically appropriate exam that must be documented starting in 2021, correct?
That is correct. Counting exam elements is no longer a requirement, nor is the documentation of the patient's mental assessment unless medically necessary. History elements are no longer used in code selection as well. No more counting HPI elements, and the review of systems past family social history are not required. However, the documentation should reflect the medically relevant history and exam as determined by the physician.
One term in 2021 that has a very strict definition that our audience should know about is medical decision-making. Can you outline exactly what that means?
Sure. So medical decision-making, or MDM, is an assessment of the impression and plan, including the diagnoses today, any necessary testing, and the treatment plan. So MDM or total time will be used to choose the appropriate E&M code. However, MDM is really going to be used most often. Although MDM was a component of the previous guidelines, in 2021, the three category definitions have changed. So first, number and complexity of problems addressed at the encounter. Next, amount and or complexity of data to be reviewed and analyzed. And finally, risk of complications and or morbidity or mortality of patient management. The final MDM is based on meeting or exceeding 2 of 3 of these definitions, and then categorized with 4 degrees: minimal, low, moderate, and high.
Let's take what you just said and apply it to a hypothetical scenario. Walk me through a patient encounter that occurs with a new patient, say in early January.
A new patient that was referred, for example, from the comprehensive ophthalmologist for a possible retinal detachment. The history may be problem-focused, and the exam, based on medical necessity, documents 9 of 12 exam elements, including the fundus exam. And the MDM or assessment is a MAC-on retinal detachment, and the plan is to schedule emergency surgery today. In this case, MDM would be considered high. The complexity of the problem, one acute illness, poses a threat to bodily function. Risk of complication and patient management would be the decision for emergency surgery. So in this case, based on MDM, the CPT code 99205 would be used.
We have a lot of changes for 2021, but there are some items that aren't changing next year. What is staying the same?
Well, E&M documentation requirements will not change when the place of service is somewhere other than the office or other outpatient services. So this would include emergency room visits or inpatient consultations, for example, for retinopathy of prematurity. Also, I-visit code documentation requirements remain the same, including comprehensive codes 92004 and 92014, and intermediate codes 92002 and 92012.
Coding is always changing. It's difficult to keep up on everything. Where do you suggest our listeners go for updates?
Well, first visit aao.org/en to access all Academy resources, including steps for implementing these new E&M changes and our online tutorial, Conquering New E&M Documentation Guidelines for Ophthalmology. You may also visit aao.org/retinapm for practice management and coding resources related to the retina practice.
Ms. Woodke, great chatting with you.
Thank you for having me.
That's all from us for this episode of New Retina Radio. Thank you for listening. Be sure to subscribe on your preferred podcast platform.
Also, be sure to leave us a review on Apple Podcasts so that way your fellow clinicians can catch up on the latest breaking news.